Good afternoon. Thank you for joining Family Caregiver Alliance for keeping your family member moving and engaged so they can remain at home. My name is Calvin Hu, and I'm the Education Coordinator at FCA and your host. For nearly 4 decades, Family Caregiver Alliance has been working in the Bay Area and across the nation to improve the well-being of family caregivers. We offer caregiver support through classes, workshops, publications, retreats, support services, research, and advocacy. You can visit us at www.caregiver.org. For the duration of the presentation, your phones are going to be muted. If you have any questions, you can ask them by going to the GoToWebinar question box on your screen. We'll answer as many questions as we can at the end of the presentation. At the completion of the webinar, you'll also be asked to give some feedback, and we use this for help shaping future education programs. So I'd like to thank you in advance for filling those out, since we always love to hear from you. So today I'd like to welcome Cindy Carterman. Cindy has nearly 40 years experience as a physical therapist. She is a graduate of Ithaca College with a bachelor's of science in physical therapy and obtained a master's degree in healthcare management from University College, which is part of University of Maryland. Cindy's private practice specializes in evaluation and treatment of neuromuscular and orthopedic disorders, with specialties in pediatric and also older adult patients. And another kind of concentration is that she does a lot of care in the home. Part of the physical therapy practice, she'll do home safety evaluations, and of course she'll make the necessary recommendations for any kind of modifications needed. She also does caregiver training to various home care agencies to enhance caregiver knowledge. Cindy's kind of main focus is providing a comprehensive approach with positive functional outcomes. Now, she's also a consultant with Dave Reynolds and Associates, LLC, personal fitness specialist. She co-authored 2 exercise videos with them, and she's a contract therapist with Children's National Medical Center and Rehabilitation Services, Incorporated. Cindy's a member in good standing with the American Physical Therapy Association, a co-director for Healthy Athletes for Maryland Special Olympics, a board member for Equipment Connections for Children, and a member of Grassroots Organization for the Well-Being of Seniors, which is in Montgomery County. So now that you know a little bit more about our guest, I'd like to turn things over to Cindy.
Thank you very much. Thank you to Family Caregiver Alliance for having me present on this topic. I was motivated to create this webinar based on my many years of experience providing home care and having contact with many caregivers and their families. I have found that caregivers and families need information, and my hope is that you will find this helpful. So I thank you in advance for your attention, and I can take questions at the end. First slide. So according to the AARP, 9 out of 10 older adults stay where they currently live upon retirement, preferring to grow old in their homes. Next. Successful aging in place, which is what this new concept is called, demands that one's home and household products provide continued enjoyment and stimulation as well as supporting declining function and enhancing quality of life. So people want to stay in their home. They want to be able to do what they can for as long as they can in their home with the necessary equipment and modifications. Next. So you're important. What you do matters. As a family member or as a caregiver of someone else's family, you see the changes of what's happening with that person on a daily basis. There is a concept that I want to talk about called ageism, where we can't treat family members based on our own beliefs, values, and expectations. In other words, if you think someone who is 90 years old should really just sit in a chair and do nothing and not contribute to their ability to live or function within the family unit, that's your expectation on that person. But that person may be a very viable part of the family, and that's something that we have to, as professionals, doctors, therapists, we have to take our beliefs out of that. So how we say things can influence your family member. Are we motivating to them, or are we just satisfied with how things are? Even our facial expressions and body language can influence family members. So if they believe they can be successful, they will be, and they'll adhere greatly to any program. Next. So how can you motivate your family member? You want to help them take responsibility for what is going on in their life. Sometimes they tend to be, if they're ill or they've been home for a while, and they really kind of become a passive person in their own life. And what you want to try to do is have them take responsibility and do the best they can, and try to help them find what goals. What they may still have goals in life. Maybe it may be as simple as being able to walk out to the mailbox every day, or get the paper, or be able to play a game of cards, or go to the mall or something. But ask them what they want to do and listen to their feelings and concerns and requests. You want to create a safe environment for them. Make them feel comfortable. Communicate physically and verbally, and encourage physical activity, which is really one of the main focuses of my talk today, is how we can encourage people to remain physically active while they are at home, so that it takes the burden off of the caregiver or the family member to do everything for them. We want to enhance that person's functional abilities for as long as possible. You want to reinforce their memory through journals, pictures, and recommend adaptations for safe living with a professional. One of the things that I do when I go into the home is make sure that there are the necessary adaptive equipment, the grab bars, maybe they need a stair lift. If they want to remain at home, then they've got to make some necessary changes. Next. So we're going to look at normal versus pathological aging. We're all aging. We can't help it. It's just going to happen, but we can still be productive and learn new things, because there is a gradual decline in most of our bodily functions. However, there's a concept called pathological aging, where there's a more rapid decline due to disease processes. There could be multiple disease processes happening at one time, which can create a faster pathway to aging. Next. So changes that occur with aging, we're talking about like a multiplicity of diseases. In other words, you could have someone with coronary heart disease along with diabetes, along with Parkinson's. Maybe they've had a stroke on top of that. There's a variety of different ways that can show itself. And each time there is a one disease process on top of the other, it can create multiple challenges. As people get older, they also have more of a narrowed ability to adapt. Anyone who's been around an older person generally, and I don't want to make too big a generalization, but they become kind of set in their ways. Sometimes they don't like to do things differently. I've always done it this way. We come in as care professionals and try to make some changes, and sometimes it works and sometimes it doesn't. There's also a change in their collagen crosslinks. Collagen is kind of the glue that keeps us together, keeps our muscles and bones and ligaments and everything attached. And there is changes that happen with that, and a lot of times that happens with postural changes. You'll see older people who sit too much, people who may be on devices too much. They get the forward head, they get the flexed body. If they sit too much, they go to stand up, and eventually over time they can't stand erect because their body, their collagen, their connective tissue is actually shortening, and it becomes more and more difficult to do basic things. There's also muscle changes with disuse. It's called sarcopenia, and that means that if you don't use it, you do lose it, and that is very, very true. Muscle does atrophy, and it does change, and because of that, they become weaker. There's hypokinesia, which also means moving less, and there's cardiovascular changes, where you can see where a person might have been able to walk a certain distance, and because they're doing less, because their muscles are getting weaker, their endurance decreases, and they are not able to do the activities that they once were able to do. There's also changes that happen in joints. You might see joint replacements, and you might see changes in the respiratory system if the person had a history of smoking, or they're sitting so much that their trunk and their body is becoming, they can't stand erect, so they really can't take that nice deep breath. So these are some changes that happen with aging. Next. Also, there are some, the senses, vision, touch, hearing, smell, taste, they all tend to dull, and some things that can make them dull are medications or diseases that can alter this. So if a person, you're caring for someone and they used to love a certain food and suddenly they've become very picky and they don't like that, well, it could be due to medication or the disease process that's going on. Hearing decreases at certain frequencies as well, and one of the most recent things that's come out is that the people, there is a thought that when someone thinks that someone in their family or their loved one is developing Alzheimer's or dementia, have their hearing checked, because sometimes it's just a matter that they're not responding or they're seeming out of it. They may need to have their hearing checked, and that is something that just goes by the wayside sometimes. Touch, there's a decrease due to the thinning of the skin, or maybe an extra sensitivity of skin because it is thinning, and arthritic changes, so it may just be, they may have pain in that area. Also, vision goes through many changes, through the change in the lens, depth perception, which would involve like climbing steps or dealing with curbs, macular degeneration, etc., and cognitive changes due to decreased brain tissue volume and decreased memory and attention. So there's a lot that goes on, and there's a lot that can maybe, that we have to kind of tap into to motivate that person to be able to stay in their environment. Next. So we look at patterns of, well, let's go back just a second to talk about ways that maybe you could stimulate some of the senses. This is not a slide, so you don't have to worry about that. But visually, if you wanted to stimulate the senses, you want to make sure that the environment is clean and that they can see what they need to see. Do they need to have vision checks? Are they wearing the right kind of glasses? So that's one way of checking. Hearing, we talked about maybe hearing aids can be helpful. Speaking slowly and clearly so that they understand your questions. Give them time to process and answer. I know it's a very tedious thing to be a caregiver and to be able to do the same thing every day for someone, but by giving them cues, giving them, okay, on the count of 3, preparing them for an activity, that's something that can really help them. Smell is our strongest sense, and you can use familiar scents like spices, fragrances to highlight that sense if you feel that that person just is lacking. Touch, we like to use some textured objects like corduroy, burlap, velvet, having them use fine motor skills like stacking coins or buttoning or Play-Doh if they've got grandchildren, if they want to try using their hands for fine motor skills like that. And taste, very important, like we talked about, to try to offer different foods to try to awaken this sense a little bit. All of this can be stimulating for them. Okay, so we look at patterns of functional loss. These are things that have been documented that we just lose over time, the ability to do these things, locomotion, the ability to get around, walk, run, skip, jump, however you want to locomote, we lose that ability to a certain extent. Reaching for objects. Sometimes if an object is high, oh, I just don't need that. I don't need to get that anymore. It's just too high for me. And one of the things that we do when we go into the home is find out what the person needs on a daily basis. Do they use the dishes that they use on a regular basis? Put them at the height that the person is so that they can be successful in getting them. And also decrease the frequency and the chance of a fall by having things that are, at arm's length for them. They also lose a little bit of thinking. We all sometimes can't remember that name or that person we met the other day. That's something that where memory games and things can come in. We talked about hearing, vision, dexterity. Maybe they lose the ability to kind of shop, do housework, maybe drive. That's a biggie, transportation, and also cooking. Next. So there are 4 giants of geriatrics that we look at. Immobility, which is to use it or lose it. That's the ability to get around and to be mobile. Instability, poor balance that causes falls. If you are weak, you're going to have increased incidence of falls because your body is just not being supported by the muscles. Incontinence, that's the inability to hold urine or bowel movement. This is a big deal because this can limit the person's ability to engage in activities or even have people over. They might be embarrassed by this, and they don't want to maybe go to the book group that they used to go to, or feel that they can engage with other people. And intellectual disability, maybe they've noticed that their memory skills are not as good as they used to be, and that limits them and can also limit their abilities and activities. Next. So we look at the importance and the benefits of exercise, and you can't pick up a newspaper or a magazine, anything that we can read these days, either online or whatever, talks about the importance of exercise, from mental clarity all the way to moving more. And I think when I try to establish an exercise program with a patient or a client or a family, sometimes the word exercise is just not a good word. Some people who have never been exercisers, and you try to tell them that, this would really be beneficial for you because it will help with your functional activities, like activities of daily living that we'll talk about, getting in and out of the chair, getting on and off the toilet. Sometimes I use the word movement instead, or I just try not to, depending on their response. But we all know that exercise, strengthening the benefits of strengthening exercises and programs for older adults have been well documented. The homebound frail older adult does present a special challenge. But we do know that physical activity at midlife can increase your lifespan. It's been well documented also that no matter when you start an exercise or a movement program, or start to do more than you're doing right now, you can increase your lifespan and increase your strength, your function, your balance, everything. It also decreases the incidence of falls, as we talked about, being strong, being flexible. It improves your gait or your walking speed and balance. You see a lot of older people tend to walk very slow and very careful, either with a walker or with an assistive device, and often that's because they know that they're weak. They know that they have to just kind of take things slow, but by improving their coordination and their strength, this can be improved. And exercise also improves aerobic, strength, balance, flexibility, all which all have overall benefits of general conditioning. One of the things when we initiate a home strengthening program, we want to look at what is their prior activity level and what are their routine physical activities. What's their motivation towards exercise, and is the family caregiver or the other, if you have an outside caregiver coming in, are they willing to participate and help that person in that program? For a frail, very deconditioned patient, of course, you'd want to start with a very low level of exercises and gentle stretching. And this is where, of course, we don't expect you guys to come up with the exercise program. We're the experts in that. But what we're going to do is try to give you some overall generic things that may be helpful. Okay, so I think we can go to the next slide. But there are obstacles to exercise, of course. Everyone has kind of an excuse as to why they don't want to exercise, and it's too hard. Many people have just a poor self-efficacy or poor self-concept. They just don't feel that they are able to do this. Maybe they've never been successful before. But as the person is in their home and their goal is to remain at home, one of the ways that we kind of can help tie this all in to success is to say, not as a threat, if you don't do this, you're not going to be able to remain at home, but tie it in a positive way, that your ability to get in and out of bed, your ability to get on and off the toilet, your ability to get in and out of the shower are all functional skills that will only get easier and better if we can focus on a few specific exercises or movements. If they see it in that way, they may make more sense to them. Some of them have a lack of appreciation for the importance of exercise. They really have never gotten any gratification out of it, and they just don't, they just don't see it as part of what they want. Another major obstacle could be pain and tenderness secondary to exercise. They may say, every time I try to do something, I hurt, and perhaps that needs to be modified again. They may have increased stress levels, anxiety, depression, may not be something that they really want to participate in. I'll tell you a brief story. I went to go see a woman who was in her early 90s. She had advanced dementia, was living in her home because her family wanted her to remain at home. She had 24/7 care. And she really was unable to follow directions. She was kind of in her own world. And I was kind of standing there scratching my head. She wouldn't even get up. She wouldn't even do anything for me. I really couldn't get her to move. Well, one of the caregivers came in and said she loves music. So we put on a CD of classical music. I put a baton type of thing, a long stick in her hand, and that woman conducted the entire CD and moved, and I was shocked. I couldn't believe how she could move. We even got her to stand up and conduct for the orchestra. So finding out and tapping into their interests and what might get them to do something is very, very important, and that was major. So again, having the family support is very important. Next. So one of the things we want to pass on today are what are the red flags that you as a caregiver could possibly be looking at as to, wow, like things are changing and maybe this person, maybe my loved one does need some help. Are the transfers getting more difficult? And a transfer means getting from one place to the other, getting in and out of bed, getting in and out of a wheelchair, getting in and out of a car, in and out of a chair, in and out of the bath, just going sit to stand. Person just can't do that anymore. That's a red flag. That should be something brought up to their physicians, possibly then referred to a home physical therapist. Same thing with walking. Is walking getting more difficult? Did they used to use no assistive device and now they're holding on to every piece of furniture? Or they used a cane and now you feel like maybe they need something more? Are they falling? The emergency rooms, number one reason why people are in emergency rooms is because they are falling, and they are falling at home. And they're falling at home a lot because the environment has not been safely secured. We'll talk about that a little bit at the end with fall risk, but talking about securing rugs down and making sure there's no clutter and there's good lighting, etc. Are they sleeping more? Is it difficult to arouse them? Are they having more memory issues? Is their appetite failing? Are they in pain? Are you noticing postural changes like we talked about before? Like they used to be able to stand up straight and now they can't. One of the diagnoses for that could be spinal stenosis, where the spine, the area in the spine narrows, and when they go into extension or an upright posture, it's very painful. So is that something that needs some attention? And also changes in endurance. Like they say, they used to be able to walk around the block, and now they're huffing and puffing, and they can't do that. So taking a look at those, and maybe an indication of they might need some help. Next. So low physical performance can be a predictor of early death and higher hospitalization and institutional rates. So we're talking about the older person, but take that to account for yourself, that, you know, no matter what your age, it's important to start working on that. You don't want to wait until something happens. So you want to be able to increase your physical performance, physical abilities. And research has shown that a daily physical activity can prevent older adults' loss of mobility. And this was in a study done by University of Maryland. So the greater percent of adults who had physical activity intervention recovered when they did develop a mobility disability. There are two, many years ago, I was in a rehab center, and there were two gentlemen came in, mid-70s, both had strokes, both on the same side of their bodies. One was a tennis player, very active. This stroke kind of came out of the blue. He was physically fit, etc. The other one was a retired, overweight, couch potato type of person, and I think you can guess who had the more motivation, who had the ability to recover faster and with more motivation. So, of course, it was the more active individual. So it really does work. Next. So before you start any movement or exercise program, you want to get consent from the family member and the doctor. You know, do they believe they can improve, and what are their goals? So, you know, you can't force someone to do something they don't want to do, although we're going to talk about ways that you can kind of bring play into it a little bit, or like I said, the conducting with the music, that you can get movement that's not necessarily, all right, we're going to lift this 5 times or 10 times. But again, get a consult from the doctor, especially if there's multiple disease processes going on. Physical therapists are, like I say, the experts in this, and getting a consult, even to do an evaluation and set up a beginning program, can be very helpful. Next. So these are some 7 primal patterns that we use. These are movement patterns that we use on a daily basis if you're physically able to. Squat down. A squat is basically every time you get on and off the toilet, you're basically doing a squat. Lunge, which is, you know, maybe lunging forward or reaching towards something. Bending, pushing, pulling, twisting, and then walking. So these are the 7 primal patterns that we use. And as people get older, they tend to become less and less engaged in their environment, and less demand put on their bodies to do this, because people are doing this for them. Oh, I'll get this for you. Don't bend over. I'll do this. And then they have the walking aids, and so they tend to lose some of these patterns. Next. So again, the 10 moves we lose over time: rotating and arching, spinal extension, standing up as tall as they can, walking with a spring in their step. They tend to be kind of, you know, slow, like we talked about. Being able to reach, or if they're a little bit thrown off balance, they can't kind of get themselves righted again. Step up, down, diagonal, lateral, crossover, all these different things that they might be able to step up and down off a curb, or up and down steps. Lunging, hinging forward from the hips is a hip hinge, excuse me. Squatting, getting up and down off the floor. If you talk to any rehab professional, they'd say that no matter what your age, you should be able to get up and down off the floor, even without using your hands, which is pretty hard. Gripping, lifting, carrying, etc. So these are moves that we lose over time, and it's because we just stop doing them. Next. So in transfers and ADLs are activities of daily living. These are things that we do every day, like bathing, dressing, eating or food preparation, walking across the room, using the toilet, using the shower. These are activities of daily living. And you want to find out, what can they already do for themselves? Why do they need help with something that they can already do? Because if you give too much help, you're taking away their motor function. They're not using their own muscles to do what they can do, and you're taking that skill away, and after a while they will lose that skill. So for the upper and the lower body strength, flexibility is needed for dressing, transferring, balancing, walking on level surfaces and stairs. So they need those skills to do that. And again, it's like with a child. Once a child learns a skill, you don't do that skill for them anymore because they've learned that, and you reinforce how independent they become and how wonderful it is that they can do that skill. Same thing with older adults. If they can maintain a skill, even if it takes 5 extra minutes to put that shirt on, or 10 extra minutes to help with meal prep, or, allowing them to maintain that skill is very important. Next. So the concept now that you may have heard about, that sitting is the new smoking. They've determined that everybody, no matter what age, really, everyone is sitting way too much because we're kind of locked into our computers and our everything like that. And so what you want to do is encourage standing every 30 minutes. If you have one of your family members that you're caring for and they get up and they sit at the breakfast table, and then they go in and they sit and they watch kind of television, their favorite show after show after show. What we try to do is encourage people to get up as often as possible. Next. So it's okay to watch, but we want to try to build in some movement breaks during commercials or when the show is ending, which involves getting out of the chair if possible. So if they can't get out of the chair and it's too difficult for them because the transfer is too difficult, or they are in a wheelchair, what we want to try to do is incorporate some type of movement at least twice during that hour of sitting, even if it's armchair push-ups with breathing, if they have no cardiac issues or no reason why they can't. But everyone can work on deep breathing. Everyone can work on a little bit of push-ups or moving those feet up and down, and we'll go through some specifics soon. Next. There are higher level activities that also can be done, like walking outside on uneven surfaces, stepping up and down curbs, walking backwards even if you had, and you might want to use kind of a gait belt if you wanted to practice that, reaching for objects in higher places and reaching for objects on the ground, but of course being closely supervised. You can use music, you can use verbal prompts, physical prompts, and be enthusiastic about it. Try to engage your family member and make the activity fun. Next. So these are some household items that I have found in doing home care that you don't need a whole lot of equipment. You need some imagination, and you can use what's around the house. Water bottles, the water bottles that everybody buys now, in the plastic, they're very nice for older people to hold even if they have arthritic hands. You can even open them up, take some water out if it's too heavy, but those are about 8 ounces or half a pound. Those can be used. Soup cans tend to be like a 15-ounce can, almost a pound. Bags of dried beans or rice can be used. Yardsticks, canes, towels. You can use what's in the home. Steps with railings. Walking up and down the steps, if the person is able to, can be a wonderful exercise. And also using walkers, standing, marching in place, and again, we'll go through some of these. Next. So these are just some suggested exercises and movements that can be done in the home. You always want to get medical authorization before beginning any exercise program. If your family member has specific needs, they should seek out the advice of appropriate medical professionals. So these movements should be done easily and to the best of their ability, and you can do them with them. They may need to have you show, what they're doing, and they should stop if they have any pain and not proceed, or modify the movements if need be. Okay. So seated exercises are, here's some suggestions that you can do, and one thing that we always want to make sure is that people are breathing, to make sure that you need to have oxygen so that your muscles can function. You want to make sure they're seated in a good supportive chair and not one on wheels. And if they're in a wheelchair, just lock the chair. Having armrests is okay, and they should have on good supportive shoes if possible, so they can sit as tall as possible. And even if the person is a little bit kind of bent over, sometimes putting a little supportive pillow behind the lower back can help with that. If you find that it pushes them even too far forward, then obviously take it out. But one of the main things that I think you should always start with is some deep breathing. When a person is not really physically active and doing a lot, their breathing becomes kind of more shallow and more what they call apical, or more towards the top part of their lungs. And what we want to try to encourage is deep breathing, where they're really getting a deep diaphragmatic breath. So 5 or 10 deep breathings, and they can start with a little bit of marching in place, lifting their knees up and down. You can use music or clapping, arms up, wide circles in both directions, and shifting the weight from side to side with some arm reaches. If you think about it, when you have to get out of a chair, you have to shift your weight forward to get your weight over your feet, and then you're able to come up. Some people with Parkinson's and some other disabilities always like to push back. They lose the ability to come forward, and sometimes that's out of fear of falling. So practicing a little weight shift, shift your weight from one side to the other, and just so they get the feeling of movement. Next. Foot circles. Really important to keep the foot and the ankle mobile. The foot is the first thing to hit the ground, and if there's an uneven surface, the foot is the first joint. There's many joints in the foot, but the ankle really is what's going to respond to that maybe crack in the sidewalk or change in flooring from carpeting to a flooring surface. And if the ankles are stiff, swollen, or they just don't have the mobility, they're going to not be able to react well, and it could result in a fall. So we like to do foot circles in both directions, and you can do all of these on yourself. And if you ever forget how a body part moves, just try it on yourself, because you have the same parts. Lifting the heels and toes, sitting, just kind of rocking your heels back and forth. Again, that's ankle mobility. Windshield wiper motion, moving your arms forward, back. Trunk rotation, which is kind of turning and hinging from the hips. Have them turn and try to look on the other side of the room. Can you see that picture way over there? Here, see if you can turn. Let's turn the other way. Let's see if we can do that. Arm circles forward and back, again, for more upper mobility. Again, breathing with all of this. You can also throw and catch a ball if a person is sitting. If they're stable and standing, and you might have a spotter next to them, or if they're stable enough, you can throw and catch a ball. In stores, they often have these balls that are kind of textured and easy to catch, easy to hold. So that's also a very visual activity. It's coordination, it's balance. It might be a little high level in standing, but in sitting, certainly throwing it side to side, have them throw it back. You could also have them kick a ball with each leg. Again, you can use a wand to kind of conduct or do upper body exercises, put on lively music. There are also things like TheraBand, which is kind of a big rubber band that comes in different resistance, and if you have that available, that's also very good. Next. So seated with a water bottle, so let's say, the person has a little bit of strength and you want to try to build on that. You can do some wrist exercises, all holding the 1-pound water bottle. They can do some bicep curls or bending their elbows up and down, turning their palms up and down, pushing that water bottle to the ceiling, alternate, and even if someone can just do one or two, think about as long as it's more than they're doing on a regular basis, that's an improvement. Arms out to the side, and then they can take that same ball and kind of squeeze between the knees and activate their inner thigh muscles. Next. A yardstick. In our videos, we use a dowel stick, and there's many ways that you can do that. You can what we call stir the pot, where you can put the dowel vertically, hold it in front of you, and kind of stir it like a big witch's brew. You can paddle side to side. I mean, it's really up to your imagination of what you can do. You can do various arm movements up and down. You can kick up to the stick. You can use your fingers to walk up and down the stick. All of these are props to help facilitate movement. Next. So we go from a functional sit to stand, which is really one of the main reasons that people have to leave their homes is that they can't get up anymore, or they're becoming a what they call in physical therapy a maximal assist transfer. It's just really difficult to get them in and out of bed, even if you're, unless you're using a Hoyer lift or a sliding board. But being able to get in and out of a chair, on and off a toilet, on and off a couch, in and out of a car, very, very important. So again, practice weight shifting, forward, back, pushing up on the armrests, again, giving them good cues. Okay, on the count of 3, we're going to practice getting up. Have a walker or the assistive device nearby to help them. And then practice standing to sitting, reaching back safely into the chair. Next. Standing activities, again, holding on to the walker. You can do marching in place. You can put some music on and make it let's just stand and march and move till the song is over, or till the commercial is over. Lift one leg out to the side, lift the leg behind them. They can do little squats with their feet pointing straight ahead. Some lunges, weight shift in all directions. Next. Kicking a ball, throwing a ball, depending on the person's balance again. Holding a small ball, passing it around. Again, these are just ideas, but these are things that maybe you're just would help you in the home, not only pass the time, but also gain some strength at the same time. Stairs can be used for exercise as well. Next. So I haven't listed any specific number of repetitions, like you might say, well, how many of these and how many of these? It really has to be that specific for the individual. Just try to get them to move any which way you can, and if you feel that you want a specific exercise program and you need that, again, that would be maybe appropriate to get a referral for a physical therapist. Next. So fall prevention strategies, real quick, we'll go through. The best way to avoid falls is to exercise, as it improves balance and maintains strength. Next. Talked about muscular strength, how it's very, very important to maintain the strength as it does decrease with age, but you can increase it with some moderately intense exercise or even some basic exercise. And it shows by picking up the feet and walking, just being able to get in and out of places. Next. Flexibility. Stretches can also help increase one's flexibility to maintain a stable and upright posture. So if the muscles are tight, it's going to affect the joints, which affects your flexibility, and it all gets tied in together. Next. Agility, balance, and coordination. So individuals with good dynamic balance can remain balanced while walking. They can step over a curb, they can carry groceries, they can unload the dishwasher. So again, all of this by building strength, building flexibility, improving balance, improving coordination, translates into these functional skills. Next. So again, with fall prevention strategies, we want to look at with a safety assessment. That can be a whole other talk in itself, but you really want to make sure that it's a safe environment, no loose cords. The vision and hearing check has been done. Their medication management is up to date. You want to keep, sometimes they talk about keeping a phone near the floor if they do fall, or they have a lifeline or some type of thing that they could call. And grab bars, railings, enhance their lighting, and make sure they have appropriate footwear. A lot of people like to wear these very, very old slippers, and they're an accident waiting to happen. Next. So taking care of yourself is important as a caregiver. The more in shape and strong you are, the better you can do your job in helping your family member, and certainly by encouraging them to maintain their health and do as much as they can for themselves, the less chance of you injuring yourself. Maintaining a good health regimen, good health care appointments, good nutritious diet. And every time you ask them to do something, they'll do something. If you stand up with them, they'll stand up. If you engage with them, then everyone's doing something for themselves all day. Next. So you can take a bike ride and go to the gym. You can walk. Exercise lowers the risk of heart disease, diabetes. We all know it's really good for everything. And the more you can become a more effective caregiver, the healthier you are. Next. So there's respite help is important if you are. I'm sure you're aware of that as a caregiver, and then sometimes you can consider home care assistance as well. Next. There are home exercise programs that are convenient. There are exercise videos that we talked about here, and I'll have a reference for that at the end. You can do them together. You can do mall walking. You can go outside. You can, if you're pushing the wheelchair, try to use proper body mechanics. But there really is a lot that you can be creative, and even if grandchildren come over and other family members, get them to engage and do something. Next. So there are many resources. Community centers often have classes, exercise classes at many levels for older adults, from seated exercise all the way to Tai Chi to other exercise programs. There's physical, occupational therapy. There are fitness specialists who work in this field, social workers, geriatric care managers. There's many resources that you don't have to kind of reinvent the wheel yourself to reach out to those people. Next. So here's an additional resource, which happens to be the consulting company that I work with, Dave Reynolds and Associates, works with older adults. We do group exercise programming throughout Maryland and our county, from nursing home level, home care level, all the way to community levels. We have 3 Parkinson exercise classes specifically for those people and their caregivers as well. I think my website and contact information, if you're interested in those and what they can offer, you can find that information in my contact, which might be next. So any questions? And then my contact information should come up. I have an email, cardaman@comcast.net, and the website, drafitness.com, is where you can find out more information about us. And I thank you for your attention. I can take any questions if you have any.
Perfect. Thanks a lot. Thanks for spending a little bit of time with us. We do have a couple of questions, so I'd like to get right into them. Let's see. First off, we have a good from one of our listeners. So they actually would like to know if you would want to recommend kind of one or maybe a small number of exercises that they could do on a daily basis that could really provide the biggest bang for your buck in terms of being able to stay mobile at home, stay functional and independent. Are there any kind of greatest hits that you could recommend for some of these movements and exercises?
Well, like I said, I think the biggest functional activity that I have seen that really makes or breaks someone being able to stay at home is being able to get from sit to stand and from stand to sit safely, because it involves getting in and out of bed, getting on and off the toilet, getting in and out of a shower chair, on and off a couch, even transferring in and out of a car. So standing, if they could stand at a counter or with their walker and just kind of do little mini squats, they could do 5 or 10 of those every hour if they were able to do that. Also, just some upper body exercises to strengthen their the tricep muscles or the push muscles, like just pushing up from a chair, because that's where really the caregiver winds up lifting the person because they're not using their legs and using their arms to help. Also sitting and just kicking the leg out. Sometimes people can get ankle weights, starting at, even a 1 pound ankle weight, getting the person to kick out to get leg extensions. That can also help. Okay?
Yeah, perfect. Thank you. We have, I guess, a bit of a related question. This listener wants to know if there's any exercise equipment that would be good for the use in the home that's also low cost. I know you recommended, the water bottles, the bags of rice, things like that. Do you have any other recommendations you think would be useful items for home exercise?
Actually, there is a little, it's like a little peddler. It's like a little bicycle that sits on the floor. They sell them at some of the drug stores. I've seen them. They're about $35, and they even have the ability to vary the resistance on it. They have kind of a little dial in the top of it, and those can be very useful for circulation, which is obviously enhanced by movement. Circulation. Person can be sitting in a wheelchair or in a chair and do, while they're watching their TV show or sitting there, they can go ahead and pedal. Those are pretty low cost. There's also free weights that you can get, 1 to 5 pound weights that are not very expensive. You can get them in any store like Target or Sports Authority. Again, being careful that you know what is appropriate weight for the person to try to use. And there's also TheraBand, or the thick band that can be purchased. I don't know if you can get exercise tubing, which is similar to that. It comes in various colors, which represents various resistance, and that can be purchased in a sporting goods store also. Some has handles on it, and those can be used for a variety of exercises. So yeah, I would say those things.
Great, thanks. And also, I remember you mentioning a gait belt, and would you mind explaining that just for some of our listeners who might not be familiar with that piece of equipment?
Oh, sure. A gait belt it's really a belt that a thick belt made out of just kind of a fabric material, or I'm trying to think I guess it would be kind of a fabric material that can latch in front, either with a buckle or you can tie it. It's just something that is used to help hold the person while they're standing or transferring. It gives, because if you're transferring someone out of bed and they've got slippery pajamas on, they're going to slip right through your arms and go to the floor. So therapists use a belt, and if you don't have one of these, you can use a man's belt, or you can tie something around them that you can hold on to around their waist that gives you the added support, gives them the added confidence that they're in good hands, and it's just it's a safety, just like a safety belt.
Okay, great. And it's gait, G-A-I-T, not G-A-T-E. Yeah, G-A-I-T, exactly. Yeah. Let's see. We have another question. Actually, I had a question about, you mentioned, falls and things, but I was recently at a conference, and we had someone who did some transfers, and she kind of mentioned offhand that if the person's falling, that really the safest thing is you just kind of have to let them fall. Now, that might not necessarily be something easy for a family member to do, but is that what you would recommend too? If someone, if they're kind of falling and slipping, would you recommend trying to keep them up, or is that just going to be too dangerous for both parties?
Well, it really, there's a lot of factors. It really, if the person has lost consciousness, obviously the best thing would be to lower them to the floor because they're not helping you at all. Or if the person is panicking and they're fighting you, you might want to also, if you're near a chair and you can calmly tell the person, look, just relax, I've got you, take one step back, feel the chair, you know what I mean? Then you're right there. Certainly, when in doubt, if the person is just pulling on you and you're in such an awkward position that you're going to injure yourself, lower both of you to the floor safely. So it's not like a one-time rule. It really is, but when it happens, it's scary because the person panics. And the best thing that a caregiver can do is to try to quickly assess the situation. And if that's the best scenario, then lower them down. If not, see what strategy you can use if something is nearby, that you can safely get to.
Great, fantastic. Let's see. I think we have time for two more questions. In terms of I know you're a physical therapist, but if our listeners are say looking for a physical therapist, do you have any recommendations on how they would go about finding someone who would be a good fit?
The first thing I would say is to talk to their physician, because the physicians who, whether they be internal medicine or a neurologist or an orthopedist, they probably have access to the therapists in your area. And that would be the best thing that I would do, and certainly get a personal recommendation from someone who's used a physical therapist. You want to make sure that person, if they are coming into the home, has had some home care experience, because it's different from working in a hospital. Or you can just contact a home health agency that oftentimes they have not only the CNAs or the certified nursing assistants, but they also have therapy staff, and they would be able to provide you with someone.
Great, thank you. So I think for our last question, I think I'll ask that. Say we have a listener who's listened to the presentation. They've been nodding their head a lot, and they realize that they want to kind of get on this. Start helping their family member do some exercises and getting them into that. Would you recommend them starting contacting a physical therapist and going it through that route and having them maybe suggest a program? Is it something they can kind of do on their own through your website or other websites? Or what would you recommend, just kind of maybe a first steps for people who really want to get started tomorrow?
Well, certainly I would, have them take a step back and take a look and have a discussion with their family member and see, first of all, if they are interested in doing something like this or incorporating a little bit of exercise into their day, and then taking a look at what they can do. Where are they weak, and what kind of things do they need to work on? If they want to get a physical therapy referral, that certainly would bring the professional into the home and get the assessment that they need. If they wanted more of a generic type of program, the videos that I talked about, there's one called Your Body's Meant to Move, which is our first video, and that's done mostly seated. And the way that it's chaptered out is that there's a warm-up and a couple of exercise portions and then a cool-down. So I've had patients just do the warm-up, and that seems to be enough for them. Or if they are more higher level skilled, the other video, which is called Moving Right Along, challenges more standing balance. So I don't want them to feel that they have to come up with a program themselves, because there are some resources out there that they could try to use. But always before starting an exercise program, they should get approval from their physician, because they might have a medical reason that the doctor does not want them to engage in something other than a supervised program. So that is the first step, is to get the medical most doctors are thrilled if they say, can they do a little bit? Sure. So, but it's for peace of mind, I would do that. And of course, if the person is exercising and they look like they're in distress, obviously they're doing too much. So.
Okay, perfect.
I hope that answered the question.
Yeah, I think that was a great response. I think that's all the time we have now for questions. You can email or call us with any additional questions that were not covered, or you can give Cindy a call or an email. Her contact information is up on the screen right now. I'd like to thank, of course, everyone for joining us this afternoon, and of course, Cindy Cardeman. Thanks again, Cindy, for spending the afternoon with us.
Well, you're welcome. Thank you. And I hope it just gives people some more ideas and validates the importance of keeping people moving. Because if that's their goal, to stay at home and to help the caregivers, have an easier time of it, then it's a cooperative effort. So
sure.
It's important.
Yeah, and definitely it seems like something like that might get lost in the jumble or the hustle of daily life, and just getting, maybe getting the grandkids or the kids off to school or paying bills. And sometimes, people just, they don't necessarily have it on their mind, but it's kind of an investment, right, in their health. Well, again, thanks so much. Just programming notes. We're going to be starting our webinar series up again in February of next year, so you can visit our website for more information on upcoming topics. So from everyone at Family Caregiver Alliance, I'd like to wish you all a very safe and happy holiday season, and I wish you a great afternoon.
Thank you. You too.